Nations around the world are calling on governments to strengthen the global fight against it, an effort to totally eradicate TB. We're joined from our Cape Town studios by Dr. Hughes, who is a TB expert. A very good morning to you and welcome to Morning Live.
Good morning, thank you.
Now, according to the Centre for Disease Control and Prevention, 1/3 of the world population are infected by TB. It's a real big deal, but some people still don't have a good idea of what TB actually is.
So tuberculosis is an infectious disease. It's caused by a bacteria which can infect any part of your body actually, but most commonly the lungs. That's what people know TB to be. So it infects your lungs and it causes a cough which often lasts longer than 2 weeks. It causes night sweats, weight loss and fever.
How can people protect themselves from getting this disease?
So the most important thing that people can do is to be diagnosed first off and get onto treatment. So the treatment that we have for drug-sensitive TB, so what everybody knows as normal TB, is a 6-month course of tablets that you have to take every day. And TB can be cured with these tablets. So it's not a disease like HIV, which you need to control. It is a disease which can be cured. Drug-resistant TB, however, is a different story.
All right, so tell us a little bit then about drug-resistant TB and if anybody can get a drug-resistant TB if they're just exposed to it.
Exactly. So drug-resistant TB is the same TB disease, so it causes the same symptoms as I've just mentioned. However, it's resistant to the two most common drugs which we would use to treat tuberculosis. So that means we have to use different drugs which are more toxic. They're less effective, they're more expensive, they're much more difficult to take, and they take a longer time to work. So people with drug-resistant TB have to be on treatment for 2 years at least, and that includes a handful of about at least 20 tablets every single day. And for the first 6 months, it requires an injection in your bum,
Sure.
which carries a risk of side effects such as hearing loss. Now, with drug-resistant TB, you can get it in the same way that you get normal TB, and that's by breathing in the air around you which has TB in it. So if somebody has coughed TB into the air and you breathe it in, you're at risk of getting the disease.
You're at risk of getting it, but should we be concerned then in South Africa with the high number of cases in South Africa that we all are at risk of actually getting this disease?
Yeah, so everybody is at risk, but there are people who are more at risk than others. So people with a dysfunctional immune system or a compromised immune system, such as people with diabetes or cancer or people infected with HIV. Now we have quite a high incidence of HIV and diabetes in South Africa, so a lot more people are susceptible to getting the disease, the tuberculosis disease.
Give us a sense of the prevalence of the disease here in South Africa in comparison to the rest of the world.
So South Africa is one of the leading countries globally in terms of absolute numbers of tuberculosis and drug-resistant tuberculosis. Probably less than 5% of our TB cases have drug-resistant TB, but because we have so many cases, we actually have quite a high number of drug-resistant TB cases compared to other countries in the world. We're surpassed by countries like India and China, but we're still quite high up there.
Have there been any developments when it comes to the treatments of TB, new research that's helped to realign maybe the strategies that doctors and experts are taking to try and fight this disease?
Yeah, so it's become quite the topic of interest in recent years. So there's been lots of research and development into, firstly, diagnostics to help us to diagnose the disease in the first place, and also into treatments to try and find better treatment for TB and drug-resistant TB, which is encouraging, but we feel like it's not fast enough. So a couple of new drugs are being developed. They're coming through the pipeline, but it's still really slow when we think of the number of people out there who need access to these drugs.
Do you believe that one day we could see a world without tuberculosis?
Perhaps one day. I don't see it happening in the near future. There has to be a lot of political and financial investment behind it to enable us to rapidly diagnose TB and drug-resistant TB and then get the treatment that's effective to people. So that means bringing the healthcare services to people instead of making people work within a healthcare system which is unrealistic.
Finally, Doctor, what should we do to mark this global TB Day?
So it's really about raising awareness. So being aware of your community, of your friends and family, whether people have the symptoms of this disease and getting tested as quickly as possible. There's a lot of stigma around TB because people think it's always associated with HIV, but by increasing the awareness and getting people to go and test for TB, we can get people onto treatment much quicker, which means that their infectiousness will drop off and will reduce the transmission within the community.
All right, so speak about it and make yourself aware about all the factors when it comes to the disease. Thank you very much, Dr. Hughes, chatting to us from Cape Town about tuberculosis and, of course, marking World TB Day on this, the 24th of March. Just an update of